Hey everyone, so I am going to be teaching today about colostomy care. So I'm going to show how to change a colostomy bag and how to empty a colostomy bag. But first, I just want to go over some of the basics with colostomy care. So a colostomy is an opening in the abdomen that is surgically created, and it's takes a portion of the large intestine and brings it to the outside of the body, and it's sutured in place. That portion of the large intestine that's on the outside of the body is called a stoma. And we do this for patients who are unable to get rid of stool on their own. So they could have some sort of intestinal injury, they could have colorectal cancer. And with the colostomy bags, sometimes they are reversible, but most of the time they're not. So in a case that you might see where it would be reversible would be some sort of intestinal injury where there was a surgery and the intestine needs to heal. So they'll have a colostomy for a short period of time, and then later on the colostomy will be reversed. Some complications that could arise from colostomy bags or colostomy would be infection of the stoma site, anemia, or necrosis of the stoma. The most common late stage complication that we see is called a peristomal hernia, and that is where the bowel actually prolapses through the stoma. Some things that we have to keep in mind with colostomy is the stigma that goes by it, that surrounds it, and how your patients may feel. So we have to teach them the proper way to care for it. So just remind them that there are ways to reduce the odor. So there are like scented oils that can be put into the colostomy bag to keep that down, and then just regularly changing and emptying the colostomy bag. So I'll go over that in more detail once I show you my patient. Hey Chris, my name is Carrie. I'm going to be your nurse, and we are going to change your colostomy bag and empty it today. I'm going to show you how to do it, but I'm also going to have you do it at the same time, okay? Okay. So first thing we're going to do is I'm going to wash my hands. I'm going to put on some gloves. You want to lift your shirt for me? Okay. So before we start, you always want to check your stoma site and see if there's any redness or inflammation. After you have had the stoma for about 6 weeks, you're going to see the swelling go down. So it should only protrude from your skin about 1/2 inch. Now, you're going to check for any redness around it. The stoma itself should be red and moist. If it is pale, that means that there's probably going to be some anemia. If it is like a dark purple, that could mean decreased blood flow. We're going to apply a towel right below it, so if there's any seepage from the stoma itself. So from there, you need to get a wet cloth, and you're going to clean around the stoma and clean the stoma itself. So you want to make sure that there's no adhesive left over from your last colostomy bag, as well as no stool. So I'm going to give you this and show me how you're going to clean it. You're going to want to clean 2 inches away from the stoma itself and the stoma.
Just like that.
Yep, perfect. Now when we go to apply the stoma adhesive, you're going to need to cut in this area 1/8 of an inch bigger than your stoma. So you're going to want to measure it before we cut. We went ahead and cut this one while we were talking. And then after you cut, just push down the edges so that way it's not poking under your skin, okay?
Okay.
So how big are you going to cut this hole?
1/8 of an inch bigger.
Okay, perfect. So I'm actually going to let you apply it. So I'm going to scoot this down just a little bit. Just peel the backing off and then line your hole up with your stoma. Before you do that, after we cleanse it, you're going to make sure that you want to pat it dry with a towel. Make sure it's completely dry. You never want to apply this to it wet because that can leak moisture, which can lead to a yeast infection.
Don't want that.
No. Great job. Now you're going to pat it down around the edges, everywhere, making sure that it's completely sealed. If not, what will happen, and what I have seen happen, is stool will actually come out from the outsides and can get all over everything, so it can be kind of messy. All right, perfect. Does it feel like it's a good seal?
I think she's on there.
Okay. Just want a little bit more pressure just to make sure. So now that we've got that on there, we're going to apply the bag. So this is just going to clip here. And when you clip it, you want to do it at a little bit of an angle, so that way when we empty the bag, it's easier for you. So go ahead and apply that. You're going to hear it clip into place.
I think it's clipping.
Oh, there's one. So we'll just check. You can pull it away from it a little bit to make sure that it's in place. And now that you've got that in place, you want to make sure that all of the air is out of the bag. You don't want any air left in the bag. And then we're just going to take the end and you're going to fold it up, which will Velcro it, and then that's going to be closed. Okay. Okay. So as we can see, your colostomy bag is a little bit full of stool right now. So when we're emptying your colostomy bag, you want to do that when it gets to a third or halfway full. This is going to prevent any odor that might occur, as well as prevent too much stool being in the bag. So the way that we're going to empty your bag, again, we're going to gather all of our supplies and we're going to wash our hands. I'm going to wear gloves for this. You're going to want to put your towel underneath your colostomy bag. Yep, perfect. Just in case anything kind of seeps out. Now that we've got that, you're going to undo the bottom part, undo the Velcro. Perfect. And then you're going to find something to put the stool in. So if you're at home, you're going to want to just do this into your toilet. For this purpose, we're going to put it into a bowl. So you're going to hold the bowl, put the end in there, and then you're just going to start from the top of the bag and squeeze all the stool out. I'll hold the bag, the bowl for you. Go ahead. When doing this, you want to make sure that we get all of it out of there because we don't want any left over. There are also deodorizers that you can put into your colostomy bag that will help with any smell. But it is stool, so smell is going to be a little bit normal. Oh, good job. And you're doing it exactly how you should. You want to start from the top and work your way down. Okay, now once you get to the bottom, you're going to want to take a cloth and clean that end, because if there's any stool left at the bottom, that could mean that there's going to be some smell associated with it. Once you've got that all off, you can just Velcro it up. We'll get that off your finger. We'll Velcro it back up and roll it back up into itself. Now, since this is a new colostomy bag, this is going to be good for about 3 to 7 days, just depending on how much excrement you have and how well it sticks. If you notice that the seal is starting to come up, you might need to change it a little bit sooner, okay?
Okay.
All right, so let's just recap. How big should the hole in your adhesive be?
1/8 of an inch bigger.
Correct. And then how often should you be emptying your colostomy bag?
Well, it's half or 3/4 like full.
You're going to want to do it 1/3 up to a half. You never want to let it get 3/4 of the way full. That's going to be too full.
Okay.
And then how often do you need to be changing your bag?
3 days?
Every 3 to 7 days. Yep. If you notice that it's starting to come off, see right here, it's actually starting to come off. We'll want to change it a little bit sooner than that.
Okay.
So, if we're going to take this off, we're going to take this off and just start over basically. So what you want to do when you're removing it is you're going to empty all of the stool out first. And then you can pop this piece off.
Oh no.
Okay? And we're going to discard that. Now, when you're removing this part from your skin, it can feel a little bit painful. So what we'll do is you can either use some normal saline to kind of loosen it up. But when you're taking it from the skin, you're going to hold your skin down. Okay, hold it taut, and then you're going to peel it away slowly. Okay?
Okay.
So I'm going to have you finish up there and show me how you're going to peel it away.
Push.
Perfect. Perfect. I think you'll get used to that after a while. Now you can see that you've got a little bit of stool on your stomach, so take your rag and clean it up. And what else are you cleaning when you're cleaning that?
Moisture.
You're going to make sure that there's no moisture, yes, but you're going to want to make sure that there's no adhesive left on your skin. That adhesive can break down and can cause irritation.
Looks clean.
Okay, yeah, looks great. So you're going to want to use mild soap and water to clean the area. And other than that, you're good to go. Thanks so much.